available on the IGPM website. Oh, why is my... There we go. Okay, so just our usual hello from the four of us. There's Joe and I on the meeting today. Joe very kindly is going to look after the chat. So if you've got any questions, please throw it into the chat. Joe will respond or we'll come back to you as soon as we can. So we're looking, let me just move that over there. So we're looking at the Community Pharmacist Consultation Service today, and I'm really pleased to say that we're joined by Pallavi, the Pharmacy Integration Lead over at NHS England and Improvement. So Pallavi, would you like to join in? I'm really sorry, there we go. Oh, there we go.
Thank you. Thank you for the introduction. I am a
I couldn't hear you then, Pallavi. I don't know whether we lost you a moment.
I think you did. So we talk about technical issues, don't we? And this is a fine example of them. So I do apologise, everybody. So as I was saying, my name is Pallavi Dowda. I am the Pharmacy Integration Lead for NHS England and Improvement. I'm a pharmacist by background, but I also practice clinically as a PCN pharmacist. So I am rolling this out within my PCN and within the 12 practices that sit within it. So I guess I want to thank you so much for inviting me along to come and talk to you around the community pharmacy referral pathway into CPCS. I guess the service, the consultation service was launched in 2019, where it was introduced through NHS 111. And then last year we had referrals for minor illness extended in from general practice. And we really do see this as a way of, really supporting general practice, not just, throughout the year, but especially through the as we prepare for winter. We see it as freeing up appointments from GPs to deal with the more complex patients and making those appointments available from a community pharmacy setting, so the right healthcare professional seeing the patient in the right time. It will allow practices to work with community pharmacy so that they can see your patients for minor illness at convenient same-day appointment with their over-the-counter from the pharmacist themselves. And it does build up those good working relationships between general practice and from pharmacy as well. We do have some really good evidence that a consultation that's conducted by that community pharmacist for minor illness does have the same outcomes as that from general practice, or if they had attended an emergency department. And with the service, we've seen that over the last couple of years that 90% of consultations are completed successfully by that pharmacist. Next slide, please. Just wanted to touch base on the types of conditions that can be referred. So you'll see these are all minor conditions that a community pharmacist is well placed to deal with. They have medication available, so we go from acne, headaches, right through to sort of tiredness, sore throats, and that type of thing. So it's just to give you a bit of an idea as to that case mix that's going on out there, and by no means exhaustive. Next slide, please. So I think just really wanted to highlight some of what happens when a patient will attend a community pharmacist. It doesn't always result in them having to buy some medication. Some patients will need just advice only. They've had a sore throat, there's no fever, they've eliminated all red flags, and they give them some self-care advice. This condition will improve on its own. You don't need anything. Do some gargling with salt water and that type of thing. But then you do get situations where somebody's been referred, and this is a real life scenario where somebody was referred into the community pharmacist. They'd got a headache, but then it transpired that they'd had a significant head blow through their boxing that they'd done the day before, and the pharmacist quite rightly referred them into sort of an A&E process. So there are various outcomes that can happen, but the pharmacist is well placed to deal with those as well. Next slide, please. So in terms of, you know, the practical things that you'd be focusing on, how do we implement this within your practices? Each of our regions have got implementation leads, and the details are on the slides here, but they are also available on the NHS Futures Hub. So please do make contact with them. They will give you that support that you need to implement this, and give you contacts locally as to who to work with to get this implemented. Next slide. We also then have some further resources that would be helpful. So I've mentioned the NHS Futures page. Please do take some time to sign up to that. It's got loads of useful tools that would help you to deliver that service. For example, the implementation toolkit. There's some briefing, which talks a co-badge briefing, which explains the pathway and how to do that. And it also has the link to the service specification that the community pharmacist is working to. And we've got some really good case studies as well as part of that. And I think you're going to hear more around specific examples after me. So I think that takes us to the last of my slides.
Super, thank you, Pallavi. For those people who've just joined us, welcome on board. Can I just remind people just to mute themselves, please, because we did get some background noise there. I'll just go into the next presentation. Can everybody see that? Has the screen changed?
Yeah.
Super duper. So I'd like to welcome now Judith Poulton, who's the implementation manager over at Avon LPC for this particular pharmacy service. Judith, would you like to take over and just let me know when you need the next slides? And we're going to be ably assisted by Peter Maynard, who's a jobbing practice manager in Bristol, who knows all about the scheme.
Fabulous. Lovely. Thank you. And thank you for inviting me to speak today. So yes, background. So I thought I would just share some of the results from Avon. And I do this just really to give you some confidence that the service will work. So we were an early pilot site, as you can see, back in July 2019, August, we started. The dips you can see probably around March, April, May time in 2020, as you can quite clearly see, will be COVID. And once we've got it back on track, you can start seeing that our figures have now started to go to 2,500 a month of referrals. So we currently have 94 of our practices live of the 102, so about 92%. And at the end of October, we have successfully delivered 25,000, or you guys have successfully delivered 25,000 referrals from GP practices to community pharmacists for patients with minor illnesses. Next slide then, please. So I guess for me, this is just thinking really wider, that when I go and train practice teams, I talk about that that's really bad timing, isn't it? From my husband. I'll just turn it off. Apologies for that. So I talk about the service being really twofold, absolutely about helping your patient with a minor illness now, but actually more about educating them as well, so they learn that actually they can self-care for the future or go to community pharmacists and not be knocking on your doors or other health establishments. Think about your pharmacies as an extension of your practices. So actually you have a highly trained community pharmacist who doesn't happen to be sitting in a room down the hall in your practice, but they do happen to be sitting in a location down the road. So it is about thinking about increasing capacity of your for your patients that genuinely need of appointments. So by taking the patients with minor illnesses away from the practice, it means that actually you can now got more appointments to offer those patients that genuinely need to be in your practice. It also extends the hours that the patient can have consultations. So bear in mind that pharmacies may open at 8 in the morning, close at 10 at night, and are open 7 days a week in some cases. So you now have an opportunity for your patient to actually have a consultation with a healthcare professional for all of that time. Next slide for me, please. So for me, there's some really key lessons. One is absolutely, this is about everybody working together. This is not working in silos. This is about the pharmacy working with NHS England, the CCG, the LPC, and yourselves to absolutely implement successfully. And that's one of the key learnings, I guess, from when we implemented it in my area. Next slide for me, please. So some practical advice for practices going live. So for me, the people that need to be trained.
Sorry, Judith, just bear a moment. Whoever's talking over the speaker, could you mute yourself, please? Thank you so much. Sorry, Judith, would you like to continue?
No problem, that's fine. So as I said, I just wanted to go through some practical points. So for me, this is absolutely about your key team members to be trained, and that's potentially your reception and your care navigators, because you need to be able to give them the confidence that this is working and that they feel happy about how the process works. Ideally, just this is personal, actually for me, this is absolutely about face-to-face. It's about engaging your audience, making sure that they have asked any questions and their concerns. That's quite hard, I think, sometimes on a virtual environment to do, because actually I think you're more in the spotlight. I also include about how, in inverted commas, they can sell it to their patients, because it is about the wording you use, and people hear very different messages depending on how you phrase it. You do need a leader who's accountable for the service, because I think that's the most successful, and I think we'd agree with most things in life that actually if you've got a leader engaged and wanting it to work, things are more successful. I guess on the back of that, make it fun. So these are some practical tips I've suggested to practices. Make it fun, easy and fun. So if they ask a patient, would suggest to a patient that actually they should go to a pharmacist, then it's maybe 1 point for starting that conversation. If they accept, it's 2 points, because it is about getting that habit of your team feeling it's fun, not about it's a chore. And teams need to buy into the idea, so you do need to give them that confidence that actually it's working. Next slide for me, please.
Oh, sorry. Oh, bugger.
Oh, we've
Sorry.
gone a few bit. I think we've gone.
Sorry.
Yeah, can we go back to the next one?
Yes, we can. But can you I'm not quite sure how I get back on my sorry, let me do this. I know, let me just do.
Don't you worry, Nicholas. Much more fun. They can see all my slides again. Perfect. That's the one.
I was a bit trigger happy with my mouse. Apologise. There we go. We're back to where we should be.
Thank you. So I suppose I put this slide in because one of the things that we learned very early from the pilot was that the training of your reception team is key. So when I started this, I offered practices training, and a lot of them very kindly said that they would do it themselves. And they did it themselves, as you can see, from September to December, and we really didn't manage to get it off the ground. I went in January, February time, and you can see that actually by having somebody come in and talk to that team has really made a difference. So I would urge you guys, if you have an opportunity to get face-to-face training with your reception team, take up that offer, because it really will make a huge difference. Next slide for me, please. So what conditions are being referred? So you can see skin and rashes are really high, but there should be no surprises on this sheet. This is your common minor illnesses, your coughs, your colds, your headaches, your lower back pain, your diarrhea, coughs, colds, sore throats. Nothing in there that I would expect to not be referred to community pharmacists. Next slide. So next slide for me is about outcomes, because I think it's really important that you understand it. Actually, yes, we've done 25,000 referrals. So from this, you can see that roughly, in fact, 68% of those patients, of those 25,000, have been successfully dealt with or dealt with appropriately by the community pharmacist. And we talked about appropriate advice. Actually, what's really interesting is that actually sales and medicines, in this case, are only 27% of those patients actually needed a product. I think we live in a society where people think they won't go and use this service because they might actually have to buy something. But as you can see from the data, a high percentage of patients do not actually need anything. The other thing to pick up is that patients are escalated back if, like we talked about earlier, they are found to have a more serious condition, or they are escalated onto an appropriate healthcare professional. Next slide. And I thought I'd finish with some positives around some feedback I've had from practices. So this is the feedback I've had. GPs have told me they're getting a session of time back a week. Massive thanks. I think yesterday CPCS was a godsend. We love it. And that was from the reception teams, because obviously it's giving them something else to offer patients. We've done 5 since 8 a.m. this morning so far. We think we're feeling really very confident. I think it's fantastic. And the last one actually was very emotive for me. I spent 18 months trying to get a practice live, and they went live a couple of weeks ago, and there was some teething problems with it, and I sorted the teething problems out, went back to phone and talk to that practice to then just go through and apologise, and they went stop. we need to tell you that actually the duty GPs and the practice manager has written to me to say, to the lady who sorted it out, to say that the pressure it had taken off those duty doctors that week was phenomenal. They were doing 25 referrals a day and it changed their life in a week. And that's me. Thank you.
Thank you, Judith. Pete, well, actually, let's open up to questions. I don't know how the chat's going. Joe, would you like to chip in? Are there any questions? Yeah.
No, there isn't anything on chat. Just a really useful link to the future to the page, but no questions.
Okay. Pete, can I bring you in at this point, because obviously you're working in a really busy practice in a very, very busy part of Bristol. How is this all working for you? Do you want to give everybody an overview of what you're doing?
Yeah, absolutely. So firstly, I just sort of scribbled down a couple of points just to re-emphasize from what Judith said. I think first up, Judith has shown the patience of a saint with all of our practices in getting us on board, keeping banging at the door and saying, this will help you, this will help you, this will help you, until we finally think, well, maybe it will. And by God does it. My reception team are just over the moon about the service. They love it. They find it is brilliant because, as we all know, our appointments are disappearing in smoke within 30 seconds of the phone lines opening. And this gives another alternative. I think we're very lucky in my practice. We literally have a pharmacy just across the way. So we already had a really good working relationship with them. But other practices in my locality have said that it's really cemented the links with the local pharmacies. And that's been very good. The training point, again, just to emphasize what Judith said, we did face-to-face training. It took a lot of organisation because we've got a big reception team, and it took a lot of time to get everybody lined up. Judith kindly did a couple of sessions so that we could cover everybody, and it just works so well being face-to-face. And I would strongly recommend, if you're going to do it and it's at all possible, take the time to actually get some face-to-face training. The outcomes have been great. We have lots of stuff that we never see again, which is perfect. Our patients, most importantly, feedback to us that they love the service. So as well as actually pleasing all the GPs and everybody else, it actually pleases the patients a lot. And we've got a lot of feedback from them. They love the fact that they can get something quick and easy that sorts out their problem.
We've got a couple of questions in the chat, and Joe, do you want to chip in here and ask Pete those questions?
Yeah, lovely, thank you. So the first question was, what about children?
So Judith can probably answer that better than me. You're on mute.
Yeah, just worked it out. Sorry. So children from the age of 1 can come into the service, and what's really positive is we're seeing a lot of children come into the service if you look at the data. And I think for me that for me bodes really well for the future.
Sorry, somebody in the background, can you mute yourself, please? Thank you.
So I think for me that bodes well for the future of the NHS, because if we could start doing this education piece in terms of children coming into the service, understanding actually they don't need to be in the GP practice, then as they grow up, hopefully we're starting to change the behaviour of a generation. So yeah, any children from 1 year upwards.
Thank you,
Judith. Joe, carry on.
Yeah. Thank you. Someone else has asked for a copy of the recording, and that will be available on the website, our website, so that's absolutely fine. Can I ask how your referrals are made? We've been offered the service in Dorset, but the way they want us to do the referrals seemed far too long-winded and will take reception far too much time.
So shall I answer that? Because we are experienced in doing it, and it's actually, we're at the stage now with the service in my practice where I'm just about to start feeding back to Judith and say, can we do X, can we do Y? We'd like to speed up the way in which we send the referrals, because we have to complete a form and then attach it to an email. It still doesn't take very long, and it's far easier than having a disgruntled patient who's shouting at you because they can't get an appointment today, or they can't get an appointment tomorrow, or they've got to call back at a certain time. So I think, as with all these services, there's ways in which we can sort of streamline it and everything else, but we certainly haven't found that that's been a barrier to us using it.
Right, thank you. The next question was, how does this work alongside our own clinical pharmacists? Who would like to answer that?
So yeah, really good question. So if I start, Judith, and then feel free to come in. So I talk around this in my clinical practice. You know, these are for minor conditions that, you know, don't need to be seen by your clinical pharmacist. You know, your clinical pharmacists are in-house doing other things, you know, your other reviews that you need to be doing and supporting in-house. So these are very much placed, you know, are best treated by a community pharmacist, because these are minor conditions that they can pick up really easily. And then, you know, as Judith has said, it opens up your appointment list, doesn't it? And supports that further.
And I suppose if I just add on to that, so certainly I've trained paramedics. I've had paramedics attend my training sessions. So a lot of your practices may have additional resources. Actually, I think for me, it's about people working at the right level. So as we've said, these minor illnesses need to come back out of your practice, because actually we need these people in the first instance to, I guess, to start learning to self-care when they've got a sore throat. And then we can use the likes of your clinical pharmacists and your paramedics, for example, and your nurse practitioners to be doing things higher up the scale that community pharmacists can't do. Whereas actually some of them are you know, ending up doing some of these minor things that actually they don't need to be doing. So again, it's just about creating time and resource back in your practices.
Thank you. Another question was, why would patients agree to go through the questions with reception when they can be booked in with a clinician at the practice who knows them and get a phone call the same day, who has access to the full records? And I guess it's about educating the patients, isn't it, that we don't have the capacity in our practice, and this is about how using the service effectively so that we can meet the demand, is how I'd answer
So
that.
shall I dip in on that?
Yeah,
I think that certainly our reception team, and I'm sure it's the same for most practices, ask quite a few questions about what the condition is, what the problem is, so that we can navigate them to the correct place. And realistically, this is just a very, very small extension on that.
Yeah.
And it just means we navigate them again to the right place for the quickest, best treatment they can get. So we found that patients were reluctant to start with, no bones about that. But gradually over time, they just suddenly think, oh yeah. And I'm sure what Judith says is right, that I would think that there are patients who pick up the phone to call us and then think, no, actually, I know where I'm going. I'm going to the community pharmacist, so I might as well just go straight there.
Yeah, just to pick up on that, actually, Peter, I've got a practice in Bristol that talks about a triangle of care, talk about practice, pharmacist and patient. They now have patients, like you say, are actually cancelling appointments at the practice because they've said, I've been to the community pharmacist first, because actually that education piece is beginning to work, and they've been live for 2 years. And actually, if we get this right, in theory, the consultations will drop, because actually we've educated people to go to pharmacy first. So it changes a whole dynamic around it.
Sounds great. Dispensing practices. So they may feel that they're going to lose their dispensing fees if they're dispensing to another pharmacy. How do we enthuse partners in dispensing practices that they're not going to lose that?
So I have some dispensing practices live because my area covers quite a variety of areas. Remember, this is for minor illnesses. This is about using a community pharmacist, and it's not about scripts, because they're not prescribing. So if the patient needs to come back because they actually do need a prescription, actually they'll get directed, or they potentially may have to go back to that practice anyway to get the prescription for the Betnovate or whatever they need. This is about offering and this is about them buying their products. Remember, it's about self-care. It's about them potentially purchasing that pack of paracetamol because they've got a sore throat, or the antihistamines because they've got a bite. But all of the stuff that needs to go on prescription will come back to the dispensing practices. I've not heard any problems in my dispensing practices where it's affected their patient base.
That's great, thank you. Someone else has put, what's been done about publicity for patients?
So I can tell you that we haven't really done much on the publicity front. I'm afraid we've been too busy doing everything else at the moment. But I suspect that a page on a website and some stuff on social media would probably help, I'm sure. So I suspect it's me lacking in not having done that. But it's not been a barrier, we find. It's not, you know, our reception team are good enough at navigating patients that it doesn't really stop us utilising the service.
So there was initially there was a screensaver for practices in the original, which I've got copies of, and there was some of my practices created a poster, interestingly, from the screensaver. Picking up on Peter's scenario, yes, a lot of practices that I've dealt with, so what have I got, 94 live, have actually put stuff on the social media. They've used the poster, they have just put some questions and answers. I have to say, for me, my experience of a long time as line management, etc., actually for me, this is about the conversations. So yes, we can put publicity out there, but actually, as we know, you can put things in bags, people don't read them. The quality of the way the service actually works is about those conversations with your care navigators and reception team. That is the bit that's key for me.
So is it possible that we could have those patient education resources, put it, say, on the IGPM website so that we could actually download them?
I'm sure I can share those with you.
Thank you. It'd be good to have a template and then the practice to just put their own practice surgery name and details in. We're saying consistent things then, aren't we, across our practices? That'd be amazing. Thank you. Someone else has put, does the practice get a record of the consultation? That's a really good question.
The practices will get a post-event message sent back from the pharmacist's consultation, and then that can go straight into the notes for the patient. Yes.
Sorry, so is that emailed to the practice? How does that get to the practice?
That's sent over by email back to the practice, just to say the outcome of the consultation.
Okay, thank you. So we've got more questions flying in. Oh, there are toolkits to help with implementation and comms. That's fine. So if we could get it on our website, that'd be fantastic. Thank you. We've had some really positive things there saying, I think this is brilliant. I personally think this is great. And the patient education that we've been desperate for to help with demand, which is absolutely right. That's amazing. We're using off practice pharmacists that we've employed to do minor illness. And actually, I'd love them doing medication reviews and audits and things like that instead. So that would be fantastic to be able to divert them back to doing that sort of work. So that's great. Thank you.
As a practice pharmacist as well, they're usually quite key to implementing the service for you as well, and to help set it up and be that contact point if there's any issues. So I know I've done a session with some of the practices and some of the reception teams, and then they go off, they do it all, but they know that they've got somebody in-house if they have a question or want to, sort out, this pharmacy won't accept this, or whatever it is, they're that go-to person, and it works really well. It builds those relationships within the practice and with your local pharmacies as well.
Thank you. So 2 more, and then we probably need to close it because we're a couple of minutes before the end. Do the pharmacies have access to translation services for those whose first language may not be English?
I can talk for Bristol, yes, because I've just sorted that out. So the pharmacists in Bristol definitely do, because I've had that conversation. So I certainly know for my area in the south, and I know that in fact the whole of the southwest, I believe, is covered by the same translation service, because I've just had confirmation. I don't know for the rest of the country, but I do know for the whole of the southwest they have access to it.
Flavie, do you know?
So I would imagine that local areas are setting up their local processes to facilitate this themselves, yes. So I would imagine that there are options available throughout the country.
Thank you. Another really good question. There's amazing questions coming through. Have any of the Avon practices started using PGDs for commonly prescribed items?
I guess whether Peter wants to answer or I think can answer.
Not that I'm aware of.
Yes, I hope you are, is what I'm going to say.
All right. Well, of course I am. I mean, of course I am. See, I told you I said the stupid things, didn't I? I told you I said the stupid things.
So, yeah, in Avon, so across BNSSG and potentially very, very before Christmas in BSW, off the hot press, there are 5 PGDs that we are using for UTIs, impetigo, sore throats, chloramphenicol and hydrocortisone cream. So those are being linked into CPCS. So actually, we have done something like 5,000 UTIs across BNSSG and taken those off practices. So you'll hopefully say, yes, you are using them now, Peter.
You are,
Peter. I do. Now that I know what you're talking about in UTIs, yes, yes, we do.
Brilliant. Thank you. Bean has asked for the website link. So again, if we could pop that on, I'm sure Ali will put that on the website for us. Last question. Has any practice experienced issues with patients returning to see the GP after a pharmacy consultation? Another really good question.
So I can say that my practice hasn't. We have had patients coming back to the practice after they've had a pharmacy consultation because symptoms have continued or whatever else, but it hasn't caused an issue, hasn't caused a problem in any way. And in fact, I think the patients were happy that they got the first line of attack, so to speak, quicker than they would have done if they waited around for a GP appointment.
That's brilliant. Thank you, Peter. So is that all the questions, Jo?
It is. That's all the questions. Yeah.
Brilliant. Thank you for dealing with those for me. Can I say thank you to Judith and Pallavi for coming on to this meeting today and giving us their time. It's been really helpful. We are recording this session, so that will go on the IGPM website. Just before we go, are there any other questions that anybody would like to ask? I just wanted to just quickly ask if there was a practice out there who were interested in the scheme and not quite got there. Is the best thing to do to link with their with the website team that Pallavi you gave to us at the very beginning? Is that the best place to go?
That would be the best place, yes,
Fantastic.
certainly. And then they'll put you in touch with whoever's local and to help
super.
support you.
Thank you very much indeed. So we'll share those details out if anybody wants to look on. And obviously, if anybody is interested, perhaps they can speak to their colleagues in their own areas and get their experiences, as we have done with Pete today. So thank you everybody for coming. Hopefully you've enjoyed this session. It's been really positive. I'm keen to see what's oh, thank you, Gail. She's put all those in the chat, which is great. Thank you, Gail, for organising that for us. And we look forward to our next webinar, which is coming up soon. But thank you again. Really, really appreciate your time, ladies. Thank you for joining us. Thank you for Pete for stepping in.
Yeah.